Bismillahirrahmanirrahim. Assalamu alaikum. Hope you're all well. Welcome to the channel again. So today we are going to talk about medical hierarchy in NHS, how systems work, different levels of seniority, and what are your responsibilities. And next video I'll go over some general advice about starting working in NHS. We are going to start by dividing it into three tiers. So the senior most tier is a consultant, the mid-grade tier is registrar, and the lowest tier is house officer or senior house officer, whatever you want to call it. Now, there are different responsibilities allocated to each role. I'm not going to go into too much detail about the consultant job because a lot of you who will be coming from abroad will not be taking consultant posts. If you are, congratulations, and we'll touch it very briefly. However, I'll start with the house officer or senior house officer level and then move towards the top. So senior house officers can be anything. It could be a training post or a non-training post. If it's a training post, it could be foundation doctors, which are new graduates, or it could be core trainees who would have done 1 or 2 exams. It can also be staff grade doctors, so people who will come from abroad will mostly be joining in at a senior house officer level. So what are the jobs and responsibilities of a senior house officer? Let me just briefly touch here that it is a supervised role. You will have some support, some sort of cover present on site to help you or give you advice. So it will be the registrar, obviously, which is the middle tier. So all the practice would be supervised. It may not be supervised directly, so the registrar may not be present with you on the ward straight away. However, there'll be a phone call away and will be able to come and help you out within a matter of a few minutes. It entirely depends on which unit you're working. So if you're in medicine, you'll have a medical registrar who will be immediately available. If you're on a surgical unit, you'll have a surgical registrar who might be in theatre but can give telephonic advice. If you're in anesthetics, you will have a registrar. In other specialties, for example, ENT, urology, super specialties, you will probably have the same surgical registrar who can give you advice. Well, what would be your jobs and responsibilities? So usually you are the first portal of contact. So you'll have an allocated ward or you'll have an allocated list of patients. You'll be doing your ward rounds with the consultant who will then give you a list of jobs to do. The jobs can be simple procedures, for example, taking a venous blood sample, putting cannulas in, taking an arterial blood gas. However, if you are in a different location, for example, an ICU, you may be expected to put a arterial line or a central line in as well. You will be asked to do other procedures, for example, putting a nasogastric tube down or urine catheter. You'll be doing some paperwork. So if you've got a new patient, you'll be clerking them in. So clerking means admitting a patient, and then you'll be expected to discharge the patients from your ward or from A&E to another location. In the meantime, if any of your patients become sick and needs urgent management, you will be the first person the nurses will call. You will go and help them out. It's usually simple ABCDE management. If you don't know what that is, you need to read it up properly. You'll then be expected to either ask for help from your seniors or refer it to a different specialty, or if it's within your area of competence and expertise, then you need to treat whatever conditions they've got. You'll be expected to request investigations, for example, imaging investigations or other investigations, and you'll be expected to follow up on the results and then inform the higher order tiers, for example, the registrar or consultants, about the results and how patients are making progress. However, let me just reiterate it to you that at any point you'll have some sort of supervision at the end of a phone or directly live present in hospital. So do not be shy and make use of that. Now moving on, the second tier is the registrar tier. So registrars are usually people who've taken their respective qualification exams. For example, if I'm an anesthetic registrar, I've done my primary Fellowship of Royal College of Anaesthetists exam. If you're a medical registrar, you are expected to have done MRCP. Similarly, for a surgical registrar, you're expected to have done member of Royal College of Surgeons exam. A registrar will have to supervise or provide guidance and support to his junior colleagues, so SHOs, and will also have support available in the form of a consultant. The consultant on call may be in hospital or they may be working from home. If they're not resident, for example, in medicine, even in surgery or A&E, out of hours, then they are supposed to come in or at least give you advice over the phone. So don't be shy and try and ring them if you are any sort of trouble or against a brick wall and you don't know how to manage a situation. Duties of registrar are very similar to duties of SHOs. So basically, you'll perform all the same jobs but at a higher level of competence than the SHOs. So you'll probably not be expected to take blood samples and put cannulas in or do NGs or unit catheters, but they may have procedures which are higher level for you. For example, if you're a surgical registrar, you'll be doing theatre cases, you'll be reviewing patients in A&E. If you are a medical registrar, you'll be expected to see sick patients in A&E or in resus. You will, for example, if you're gastroenterology registrar, you will have your clinics, you'll have your endoscopy lists. If you're a respiratory registrar, you'll again have your clinics, you'll probably have your bronchoscopy lists. And if you're a renal registrar, again, your clinics, your dialysis, and all that. In the same time, sometimes if you have junior members of staff not present in hospital or sick for any reason, you may be asked to step down and cover for them. So if you're a registrar, it is very important you also know how the junior members of your team do whatever they do, because sometimes if your junior is sick or not able to attend, you may be asked to do or step into their role. You'll be making decisions about admission, out of hours, and discharges. Most of the time, discharges are consultant led. And if you've got any referrals which are too complex for SHOs to do, then you may have to do those referrals. Any moment in time, let me just reiterate, ask for help. If you don't know what you're doing, you have senior consultants who are at the end of the phone. There is always an on-call consultant for every specialty. So do not be shy, take advice from them, even if it's in the middle of night, because that is what they are being paid for. Something I forgot to mention at the beginning is what kind of roles are registrar roles. So it could be training or non-training. If you're a trainee, it is called a specialist trainee or specialty trainee. If you're non-training, then again, you would be expected to have the level of competence, have done some exams, and then you can be a staff grade doctor or non-training doctor employed by the trust. Now, consultant. The general idea is once you become a consultant, you are an independent practitioner, you fly solo, but that is not entirely true. So even when you become a consultant, you have support available in your department in the form of other consultants, senior consultants, and even your senior registrar body will have some input. So if you feel like you need a second opinion or you feel like you're in a bit of pickle and you need some advice, the advice and support will be available to you. Now, consultants can be from a training pathway. So if you have completed a training pathway, you'll become a consultant at the end of that and you'll then have to get a job. Or it can be through a non-training pathway. So people who are not in a training post can still become consultants as long as they can get their competencies for consultantship signed off in time. Duties of a consultant are manifold, so I'm not going to go into too much detail. You will have a clinical responsibility, so you will be in charge of admitting patients, discharging patients, doing your ward rounds, reviewing very sick patients. The patients will have a named consultant when they are admitted to hospital. In addition, you will have a supervisory role, so you'll be supervising your registrars, your house officers. You will have trainees who are under your supervision. You will have an administrative role, so you will be probably allocated a role to be in charge of rotas, of leave, etc. You may have management roles, so you might be in charge of, let's say, airway in anesthetics, or you may be in charge of regional anesthesia. In A&E, you may be a resus lead, or you may be a liaison lead. So there are different management roles which are there to be grabbed. You'll also have some commitment to education. So every hospital in England will have medical students coming to them. So there'll be different consultants who may have a role in education. So you may have medical students you have to take to teaching. Over here in consultant posts especially, all the responsibilities do not rest with a single person. So you'll have a clinical director of your department, but the clinical director is overall in charge. However, most of the jobs are distributed evenly among the consultant body. And that is all I have to say at the moment, really. I'm not going to tell you how to manage your family life because that's outside the scope of this video. The main idea was just to tell you how the NHS medical system works. I'm not even talking about nursing or midwifery system. What is different levels of seniority and what are different responsibilities which come with it. In my next video, I'm going to touch on some general advice if you're coming from abroad and starting your first NHS job. Stay tuned, keep on watching, subscribe to the channel if you like my videos. If you like this video, please give us a like. Take care. Allah Hafiz.